Hey guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I am a U.S. Army veteran, former CMP examiner, and physician assistant. So today I wanted to come on and discuss a condition that I treated quite a bit while I was on active duty, and that is pseudofolliculitis barbae, or sometimes referred to as PFB. So pseudofolliculitis barbae is a condition where veterans, usually it's in the beard area, but it can also happen on the back of the neck, where many veterans will get what they would call shaving bumps, right? So due to the requirements, as we all know, the veterans have on active duty for shaving, whether it's the back of the hairline or the beard area, they can get ingrown hairs or hairs that are very curly that don't respond well to shaving, right? And they would get what's called shaving bumps. Many service members will get on shaving profiles where they can only grow their hair, like, I don't remember what it was, like a quarter of an inch or whatever, so that they could try to decrease the amount of shaving bumps. They would be treated with different types of medications to help reduce the bacterial content if it would get infected, or perhaps the scarring. There were even lots of veterans while I was on active duty that would be authorized to get laser hair removal to try to take care of some of this. But that's also very difficult because later in life, not all veterans want to, they want to be able to grow their beard back. So not everybody opted for that option. So specifically, lots of younger soldiers that would get out with only four years of service, might not want to go through that. So this is a condition, especially if it continues after service, or if you have scars related to those incidents that happen, that can be rated and service connected. I don't really think that there's a situation that I can think of that would require this to be a secondary service connection. I'm sure there's something that someone can think of that this could be secondarily related to. I can't off the top of my head. Every time I've seen this be service connected, it's really been in relation to a direct or primary service connection. So again, the veteran had it while on active duty. Maybe they had a profile, maybe they didn't. Maybe they have buddy letters that support it, or pictures, things like that show that they were suffering from it because they didn't want to go in and get seen for it or whatnot. But the residuals of this especially can be related on as scars, right? So you can be rated for any type of scars if you have a scar related to a service-connected disability, whether it's, you had a surgery, you had even acne, you can get scarring if you had that on active duty. But this condition in particular, I've seen get rated, 30% sometimes related to the scars that a veteran can have from being treated while on active duty for this. So again, they probably need to have residuals or still have effects from this after service to be able to show that it's still a disability. Sorry, you guys can see my little puppy there in the background. Hey, Freddie. Sorry about that. He just video bombed us. So at any rate, I think this is one that a lot of veterans don't realize can be service connected, and that many service members suffer from. So if you suffered from pseudofolliculitis barbae on active duty and you have scars, it was well documented, things like that, it's something that certainly can be service connected in many cases. There's an article that I like to reference sometimes when I discuss this. Again, Nexus letters are never required. Sometimes they can be helpful, but in a case like this, if it's very well documented and you still have residuals from this, I think it should be pretty straightforward. But there's an article that you guys can look at and you can share with your treating providers. It's called Pseudofolliculitis Barbae in the U.S. Military, a review. It was published in Military Medicine in 2021. Okay, so it specifically says pseudofolliculitis barbae, or PFB, also known as ingrown hairs, commonly results from adherence to military grooming standards and those who have curly facial hair. Many patients respond to specific grooming techniques or topical medications, but severe cases often warrant restrictions or shaving or laser therapy, as we discussed, right? It goes on to say that PFB has a long history in the military, dating back to World War I, when shaving was enforced not only to ensure good personal hygiene and to foster good order and discipline, but also to ensure gas masks would seal in the event of a chemical attack. The management of PFB has presented a challenge in the military and even led to a social uproar in the 70s. Policy changes in the military regarding shaving limitations or profiles have historically influenced how PFB is managed, but the basic tenets remain the same. Grooming techniques and topical medications can be effective in treating mild to moderate disease, but more severe cases of PFB respond best to laser therapy. Limitations on shaving remain an important part of management, especially during flares of the disease and while initiating therapy. Long-term shaving profiles may be needed to treat resistant cases. Lots of veterans would have, or service members would have, permanent shaving profiles, right? So this article concludes that PFB is a prevalent skin disease in the armed forces. Better understanding of the disease and patient's individual needs by the healthcare provider and commander is paramount, right? So really, people could get really frowned upon for not shaving, right? So it's always, it can be a dispute and cause a lot of problems with good order and discipline and be problematic, right? So due to that culture, you see a lot of veterans with scarring, right? And then also there's not a lot of good education on how to manage that condition. So are they using the right razors? Are they using the right, shaving cream or whatnot to help prevent, the condition from worsening, right? So if you have been treated for Pseudofolliculitis Barbae on active duty, you have residuals of it, it's certainly something you should consider going for and claiming if it's still bothering you. Also, I've seen lots of veterans with secondary service connections to the PFB, right? So I've seen veterans get depression and anxiety related to it because they have permanent scarring on their faces, right? And then so on and so forth. If you have a mental health condition related to that, other ailments can present themselves as well. So I just think this is a really little known condition that a lot of veterans don't even realize they can be rated for. So please drop some comments if you guys have any questions. I'm happy to answer them. And if this is something that's been bothering you, you should maybe get with your VSO and see if they can assist you with that. I'm not an accredited agent or an accredited attorney or a VSO. I'm just a medical expert. I've gone through these types of cases before as a CMP examiner and in my current position. And there's Freddie. Hey, Freddie. Come here. Well, maybe he'll say hi in the next video up close. Oh, here he is. Hey, everybody. This is my buddy, Freddie. He's up late with me. Oh, and there's Penny. Okay, enough of my personal stuff. So I'll see you guys later. Drop some comments and we'll talk to you guys soon. All right, thanks.